Welcome to Aging in Place Strategies and Answers with Linda Prio. Will it be possible to remain in my home as I age? Do I feel safe in my home? How do I figure out how much support I will need when my health needs start to change? What if I decide to move into a community instead? Which community will meet my needs now and in the future? Who will play a role in helping me with decision making? Do you ask yourself these same questions? Aging in Place Strategies and Answers can help you gain practical knowledge that will help you create your own Aging in Place roadmap. If you are already a care partner, a power of attorney, or in crisis mode with your Aging in Place strategy, you will learn what you need to know that you don't know. For over 20 years, I have been marketing Aging in Place services to clients and educating families and healthcare professionals in how to put aging in place strategies into place. When you utilize aging in place, you are allowed to choose where you want to live and make those decisions so that you can retain your quality of life. Listeners, welcome back to Aging in Place Strategies and Answers podcast. If you look in the program, you will see that there have been other podcasts recently that have done some education on a medical model of care versus a patient-centered model of care. And I think it would be important for you to have that as a backdrop to what we are going to be talking about today. In addition, I also launched 2 episodes with Hedva Bernholtz-Levy, where we discuss the age-friendly health system initiatives, which included the 4 M's. And so having that as part of your education will help what we're going to discuss today make more sense. So if you didn't listen, I would encourage you to go back and do so. But if not, welcome to what we're going to be talking about today. And that is recognizing what care model your healthcare team is practicing and how that will be very helpful so that you can prepare for your next health visit. Better communication always leads to better outcomes. And that's what we are discussing today. Here are some additional truths that my regular listeners have probably heard me say before, but they do bear repeating because, as you know, I am a professional in senior health, and these are common conversations that we have. And so I do find that these truths bear repeating. Number 1, medical insurance drives your health care. And so one way to be less frustrated is to really participate in the kind of health care that you are choosing. In other words, your insurance product. So make sure that you're not frustrated by the insurance that you choose. And if you are, figure out logically, these things are announced when you can make those changes legally. Okay? So there's many times that you can. And if you're not frustrated by your medical insurance, then you can check that box. The next thing I want you to know that as a patient, you have rights, and your rights as a patient are front and center. And at any point in any conversation that you feel that your rights are being denied, then you should be speaking up. And if you don't know what those are, then just do a Google search for patients' rights and you're going to have it right in front of your face. I also want to remind you that a consultation appointment is longer and it is not the same as your usual 10 to 15 minute checkup. So if you need a longer appointment to discuss treatment plan, or if you need to understand more about your diagnosis or health condition, then ask for a consultation if your provider hasn't offered that up front. Many do, but there is a distinction between those two appointments. And then the last thing, which I think is very important, is that understanding what your own health goals are. Are you relying on your healthcare provider to tell you what your health goals are? Or are you coming up with health care goals that you would like to have in place, and then utilizing the professional experience and knowledge of your healthcare providers to help you get there? So maybe that's where you and I need to spend some more time, is just really figuring out what our health goals are. And can we meet them? How do we amend them? Or what is it going to take to get there? And it may not always be a prescription. Okay, so let's just be honest about that. Coming prepared to your appointment is really very beneficial. And this is one of the reasons why the Institute for Healthcare Improvement has developed a checklist that helps you prepare for that doctor appointment. And in the podcast where we discussed what the 4 M's are that will help you prepare, those are what matters to you, the medication that you're taking, how your mentation. So are you confused? What's your mental status and mobility affecting your health? So I'm going to take a quick discussion overview of each of those sections. And then as we near the end of this podcast, I'm going to introduce a new term, and that term is palliative care. Because once we work through the process of what I just shared, your health goals, making sure you're getting the right kind of appointment, making sure that you're communicating. Now we work through the 4 M's, and then the next section needs to be honest discussion of where am I in the process of all of this, with what you see and with what I'm experiencing. So let's do that quick review first, and then we're going to talk about palliative care. For those that might have taken a deep breath and said, oh gosh, we're going to launch into end of life discussion. Not really. Palliative care is not hospice. It is another form of care. So just hang with me. I promise I will line this out and explain it to you in ways that we can all understand, so that we know how to use what we're learning. So what matters is the first thing that age-friendly health systems will be asking you. What is going well with your health, and what could be going better for you? So what might that answer be in your world? What's going well with your health, and what could be going better? And answer that question and be prepared to answer your physician. Also be prepared to let your healthcare team know if there's been any changes in your health. Something that's harder for you to do, something that you've just begun experiencing, or maybe there has been a life change, such as a loss of someone that is dear to you. Maybe it's a job loss. Maybe there's been changes in your sleep pattern. Maybe there's weight loss or weight gain. And then we want to also be prepared to report if our health is affecting our ability to do what we have normally done and enjoy doing. So I was listening to a lady discuss what she was appreciating about a particular social activity. And she said, I am not able to work anymore, but this social activity means a lot to me. So that would have been something reportable, is that to your care provider that, this has been a change for you, and, has it started to affect your health, or are things going okay even though you've experienced this? So how is your health affecting your ability to do what you enjoy, or how have these changes in life or in job now making some other changes in your health? Now, the next section, of course, is a medication review. And so it's important that we bring a comprehensive list of current medications, as well as over-the-counter items that you take. And while you think, Linda, that is so simple. Sure, I should do that. Yes, of course. You'd be surprised at how many people really do not have a grasp of what their current medication list is. And even in your chart, you may have medications listed in your personal medical chart that are still there that you're not taking anymore. And so it's really important that you and your healthcare team come to an agreement about which medications you're currently taking, and which medications you think you should be taking, and which medications your doctor has prescribed for you. And I know what I'm talking about, because there's so much medication mismanagement, as well as lack of medication adherence, that in the healthcare field, a lot of problems can be avoided when people actually know what they're taking, what they should be taking, what should be deprescribed or re-prescribed, and then again, all the other things that we take that we don't even think about. I recall a story from a friend of mine who said that one of her friends had shared that she really wasn't feeling that great, and she went to the doctor, and he said, "Well, are you doing anything different?" And she said, "No, but I do like this one herbal tea," because he probably asked, or she asked, "Are you taking any herbal medicines?" And she said, "No, but I do like this one herbal tea." And the doctor said, "This is a problem for you. You need to stop doing this herbal tea." So something as simple as that can sometimes affect your health. So make a list, check it twice, and bring it to your doctor's visit. And then check your electronic medical record and make sure that that agrees with everything that you and your doctor are aware of. Then you will want to also share with your doctor whether or not you can afford the medications that have been prescribed, and if you have accessibility to those medications. A friend of mine reported to me a couple of weeks ago that someone had recommended a medication to her that she was seeing a lot of positive signs, and to ask her doctor if it could work for her. And the doctor said, "Well, it doesn't come in that dosage. I don't understand why you're asking me to prescribe something that isn't available." And she affirmed that, yes, that's exactly what a friend of hers was taking, and come to find out it was a formulary. And that's something totally different than going to a pharmacy. A formulary makes formulas and very specific, can put together very specific doses of medications. So something as simple as a recommendation from a friend can also, cause confusion. And so accessibility to the medications that are being prescribed, are they available? And can you get that medication on your insurance? What is the problem? I also have a friend who takes medications on a routine basis, and every year they don't send her the medications. Well, that's not on her. That's on the insurance and the pharmacy not working together. So when we talk about accessibility, those are some of the problems that can really affect your ability to stay healthy and be healthy. So report those and get those roadblocks out of the way. And then again, your health goals. And I'm bringing that back up again because, some people don't have health goals, have not thought about health in their own perspective. Like, what does it mean to me? Well, how do I want to feel? How are these medications helping me? Are they helping me to reach my health goals? Do they make me feel better? Am I having side effects from these medications? And you want to be able to report those so that your healthcare team has a good overall sense of what is your reaction to what the prescriptions are and the treatment that they're providing. So, as you know, and I know, as we watch TV and we stream more and more of the shows that we like to watch, I see many commercials highlighting supplements as well as alternate ways to obtain different types of drugs. If you forget to report something that you're receiving that might be a supplement, or if you're getting a drug that is not coming from a known pharmacy, it could put you at risk for a side effect or interaction from that medication. And so being able to give your physician a full picture of what you're taking could prevent a hospitalization or some serious side effects. So if you are seeing those same supplement commercials and you are seeing those same commercials offering to provide these drugs from another outlet, bring that up to your physician so that he knows exactly, or she knows exactly what you're taking. And sometimes it's just a good time for an honest question. And it can be hard for us to think of ways to bring up or even question our physicians or our healthcare providers. So what could be an honest question that you could ask your physician? I knew somebody who had been diagnosed with congestive heart failure, as well as had emphysema and a pulmonary disorder, a chronic pulmonary disorder. And the question that this person asked their physician was very simple and very honest, and it was this: Doctor, I understand that I have these diagnoses, but it seems like I'm taking a lot of medication. Is all this medication and all these breathing treatments necessary for me to maintain my current health status? And the doctor reviewed the medications, went over each one with this patient, and the patient realized that yes, it was very important to stay on this prescribed treatment plan so that they could live their best life, even though they had two chronic conditions. However, there was another senior adult who had lost a significant amount of weight and wanted to ask the same question because they were experiencing some falls and they were passing out when standing up. And so they just asked their physician whether or not they needed the same dose of blood pressure medicine since they weighed 20 to 30 pounds less, and they were experiencing these symptoms. And by bringing up this honest question, the physician evaluated the dosage, agreed to reduce the dosage over time, and the patient started doing well and has had no falls or passing out since then. So an honest question, looking for an honest answer, is how you work well with your healthcare team. The next part of the 4Ms is your mentation. It is really about noticing whether or not you or someone else have noticed changes in your memory, or if you have noticed whether or not you are more anxious or lack the enthusiasm and enjoyment for activities you used to have. And so this also is reportable. Let's take a word from our sponsor.
Do you want assisted living services but don't want to leave your home? Call Continuum at 314-863-9912. Our professional team has 20 plus years of experience and will help you create the perfect care solution that meets your current and future needs. Continuum supports independence at every stage of life. Call 314-863-9912 for a free consultation or visit us at continuumcare.com.
Welcome back to the podcast. Now, we are preparing for our doctor's visit, and the reason why we are going to report changes in our memory or in our mental health is because if your physician doesn't know, then they can't help you. So again, the physicians and your healthcare team are not detectives. They don't see you on a regular basis. So if you don't know the answers to these questions, that's perfectly fine. Just ask somebody else. Have you noticed any changes in my well-being or my memory? You know, some folks find that they go through changes, and this is very normal. We are human beings. We are not machines, and we do the best we can, but there are things that rock our world. And so when we become anxious or worried or depressed, it is noteworthy. And I just had my depression screening by Medicare, so this is already part of what they're looking for so that they know how to help you best. Did you know that depression is very treatable? So there is no reason to suffer, and that these treatments work very well, but it's important to know what will work and what is going to work best for you. And that is why you bring this up to your physician. And your mental status does really affect your health. They are directly related. So if you think about your health goals and you want to live a healthy, happy, engaged life, then this is reportable. So don't leave this out and bring this to your physician's attention. If you're not sure about your memory, describe how you feel. Does it feel like brain fog, or does it really feel like confusion? Have you gotten lost recently? Ask your healthcare providers if there are any medications that you could be currently taking that are affecting your mood or possibly even your memory. Have you had a recent urinary tract infection? Is that the root cause? Or do you have a smoldering, in other words, a urinary tract infection that isn't really cured and resolved? And sometimes people walk around with these and they have no idea they have them, and they can cause a lot of problems. It could look very much like brain fog or confusion, or it could really affect mood and memory. So be aware too that hospitalizations have been shown to cause delirium and confusion in most patients, but especially in senior patients. But delirium and confusion can also improve when back in familiar environment, but it does take time. And when those hospitalizations are more frequent than delirium can be present and be a little harder to resolve. Getting answers helps each one of us to allay the fears that we have surrounding these issues. But when you get an early diagnosis or get treatment, then you can put yourself back on a path to helpful planning and better health. So now we have to look at the last part of the 4Ms, and that is mobility. Has your ability to move or to get around changed? And if it has, again, what we're trying to disclose is that the mobility is affecting my ability to enjoy my life and to live my best life. So, please be prepared when you see your physician to describe what tasks you have more difficulty doing. Is it standing? Is it walking to the mailbox? Shopping for groceries? Maybe you feel lightheaded or dizzy, and that is affecting your ability to get up and move around. Mobility can be very treatable with therapy, and in some cases, simple surgeries can improve it as well. But more often than not, you're going to be, sent to therapy so that the therapist can evaluate if this is treatable or not, or if the next step might be a surgery. So our takeaways for the 4Ms, so that we can recap this in our minds, is the importance of creating health goals for yourself so that you can live your best life, and then to bring those health goals to your healthcare team, but also to become a better reporter, to come prepared to appointments, and to be honest if you can't make it because you're not able to get there physically, because your healthcare needs have really changed, or if you don't have a ride to the appointment, let them know that you need a telehealth appointment. They won't know that unless you ask for it. And there's sometimes that they can do that, and then there's sometimes that you just have to be seen in the office. But remember, better communication leads to better medicine, and that also means fewer hospitalizations and less time spent recovering. Now, as I promised, I'm going to introduce to you a new term, and this is palliative care. And even in the health field, many people may not be aware of what palliative care is, but that doesn't mean that I don't want you to be aware of what palliative care is. Palliative care is a specialized medical care for people living with chronic conditions or serious illness. This type of care is focused on providing relief from the symptoms that you experience and the stresses of the illness. The goal is to improve your quality of life, and it is also so that the family or those caring for you know what your goals are because of the conditions that you have been diagnosed with and the stresses of that illness on your body. So everybody knows what is going on here. Now, palliative care is provided by a specially trained team of doctors, nurses, social workers, chaplains, and other specialists who will work together with a patient's other doctors to provide an extra layer of support. And this is what I feel is so important when we get to this point in our healthcare. It is to provide an extra layer of support. It is based on the needs of the patient, not on the patient's prognosis. That means the future of those conditions or that diagnosis. And it is appropriate at any stage and at any age in a serious illness, and it can be provided along with curative treatment. So this is not hospice. This is another layer of support, and this is called palliative care, specialized medical care for people living with chronic conditions and illness. Now, I want us to return to the earlier illustration of the man with congestive heart failure and chronic obstructive pulmonary disorder, which is COPD. In the earlier illustration, the man asked his doctor if he would need to take all these medications to manage his pulmonary and heart issues. This was a great question because the man knew his diagnosis and he understood that his chronic conditions would not improve. He appreciated his doctor's honesty, and he agreed that he would continue to take the medications because he knew that his day-to-day life was really improved as a result of taking that medication for his treatment. But 3 months later, the man tells his doctor that he was in the emergency room every month, and he had been admitted 2 times out of those months that he had gone to the emergency room. He told his doctor that he felt worn out physically, that he had become anxious about the increased symptoms of his conditions and the financial burden of the hospital admissions. The doctor explains to this man that this can be very common for someone with his diagnosis, but the patient also asks what other options he has at this time. His physician explains that it is possible to consult with an outpatient or an at-home palliative care provider. And the patient had not heard this term before, and the common leap that most of us would make is that, oh, he must be talking about hospice. And so the patient says, is this hospice? And the doctor says, no, this is palliative care. This form of treatment is another layer that will allow you to live your best life with your illness and manage your symptoms if and when they grow worse. I'm going to stop here and not talk anymore about palliative care because my next podcast will be about palliative care versus hospice so that you know the difference and you know what to ask for. As always, I end each podcast with a caregiver tip, and I know that caregivers are team players. So when you are a caregiver, you are attending most doctor visits. You're there at many hospitalizations, at diagnostic tests, and all kinds of things. But you and I both know that when we are able to get good answers and good direction at checkups and consultations, there will be fewer health hiccups. And those health hiccups not only affect the person that you're caring for, but they also affect you as well. So ask the person you're providing care what they would like to know or what they feel that it's most important to report at their next office visit. And you can use the 4 M's to walk through the important parts of an age-friendly health system doctor visit. Sometimes you may not get much of an answer. You might get, I don't know, you tell them what you think they need to know. And so sometimes you do know best. So speak up at the next office visit and get your question answered and follow the 4 M's so that you are not all over the place when you're talking to a physician, because you want to be strategic so that you can get answers. Perhaps you are beginning to see the signs that your loved one has increased weakness and they are becoming tired of going back and forth to the hospital and they are getting weary from their treatment plan. Be aware that Your medical teams are focused on preventive care and treatment, but when your loved one is too tired or they begin to say they just don't have the strength to continue or they wish this was over and they felt better, now's the time to start thinking about what are the next steps? What do we need to know? And is there another layer of support? And ask perhaps about, is it time for palliative care if the prescribed treatment plan doesn't appear to be working? Caregivers, your role as an advocate and someone who is willing to do the hard work and speak up really makes a difference in people's lives, and I thank you for all you do. Listeners, do you need a speaker for your group? Or perhaps you would like to know how to access my YouTube channels? Please check out my website, seniorsupportstrategies.com. On the website, you will even find more details about how to get a personal consultation. Thanks for listening. Thank you for joining me today. Please remember that this podcast is intended as education and not advice. Don't forget to share this podcast with family, friends, or colleagues who want to learn how to age in place, but also share this with those who find themselves in crisis mode. Please go to my website, seniorsupportstrategies.com for more information. When you subscribe to Aging in Place Strategies and Answers, you gain access to premium content and professional tips on creating your own Aging in Place roadmap. As always, I value the time you spend with me.